I'll motion to approve.
A second?
I second.
Any objections? Approved. For some reason, the September meetings minutes were included again, but I'm pretty sure we went through the process of approving them, so I'm just going to pass on by that. Any objections there? Excellent. Organizational issues. I would like to point out that this is the first meeting this year that is the third Tuesday of the month, and so I think we should have a
Monday.
big hooray for that.
Third Monday.
Is it Monday?
Hello,
It is Monday, right? Yeah. Is it Monday?
my apologies for not having the microphone on, but we, did I say Julie? Lisa, I'm sorry.
I'll answer either.
So, moving on, the organizational issues. Next month, we are the second Tuesday of the month, the 11th. I think mainly because getting any deeper than that into the month runs the risk of losing everybody to Christmas season travel. I'm just bringing that up to remind you, and it will be, it's only, I think it's 3 weeks away from today. So, and then the meeting after that, we will have, at the beginning of the year, election of new officers, as we do every year. I'll send out the brief paragraph that Kevin prepared right before he left about what that's about and how that will go on. And if anybody's looking for leadership positions, you should start considering that now. And other than that, I think we have a fully formed up board, and I'm not aware of any other organizational issues. Anybody have anything to add?
One thing to add, which is that although the township calendar for January is not up on the website, our first meeting in January will also not be on the regularly scheduled time because that's Martin Luther King Day. So the first meeting in January will be the following Tuesday at the regularly scheduled time, 5:30. Yes, so it'll be one day late.
Perfect, thank you. Thank you for that. Okay, so any other comments there? So the next issue is community infectious diseases, which we blew past last time, but I think deserves a few minutes, as we are in November, for a discussion. At the global level, let me back COVID towards the end of this. I actually went on the Pennsylvania Department of Health dashboard. It was actually very helpful for local updates, relatively local updates. The only issue I have there is that they update every Tuesday. So the data that we're basing this on is actually a week ago last Saturday would be the last update for that. And we are in a dynamic time when it comes to respiratory diseases, so changes may have occurred. But at the time, influenza activity in Pennsylvania was low, not minimal, but low. In the United States, it remains low. But the number of places that went from minimal to low or from low to present did increase. I cannot adequately emphasize how important I think it is for everybody, and I mean everybody, to get their influenza vaccine, and at this point there is zero reason to wait. At this point, if you got your inoculation today and you got a 6-month protection window, it gets you out the other end of any possible epidemic flu. That's number one. Number two, the variants that are being seen are variants that are covered by this year's preparation, and that is a good thing. And so now is the time, as people are heading into travel seasons, holiday seasons, as outbreaks are starting to pop up. If you haven't gotten it, now is the time. And also, let's not forget that there are, in addition to vaccination, other ways to prevent, and with influenza, fomite management, which means hand washing, is critically important. So the next of the 3 viruses that are getting the most attention these days would be RSV. Let me just add that the shape of the influenza and RSV curves this year are back to a pre-pandemic kind of shape, one that is familiar to the epidemiologists that follow it, probably certainly for the first time since the 18-19 season. So in 4 years, back to pre-pandemic. Last year, we had big early peaks with a fear of a huge, quote, triple-demic, unquote, not a term I love, that never materialized, but the peaks were early. This year, they seem to be forming up in a more particular pattern. The RSV vaccine, RSV in Pennsylvania and the United States has been increasing, particularly among those under the age of 5 months. Let me just reflect. My personal feeling about the RSV vaccine is clear. It's cleared for everybody. It's cleared for virtually everybody, but and the Pfizer version is cleared for pregnant women and infants. The Glaxo is not, but I don't believe that has to do with anything except the data that were presented to the agencies for clearance. And they're recommending it for people for whom it is cleared. My own personal opinion is that if you are over 60 and have any of the additional conditions that are listed in the indication, you should consider it. And if you are going to be in the presence of young children, or in the presence of somebody who's going to be in the presence of young children at any time in the probably 72 hours prior to when you are going to be with those people, you do have a risk for a disease that can be morbid and even mortal, and should consider the RSV vaccine. I think you should make that decision in collaboration with your healthcare provider. Again, influenza ER visits and diagnoses are low. RSV is really only increasing among the population in which it's virtually 100% penetration virtually every year, and that's the very young children. When it comes to COVID vaccination, I think the new vaccine is a new vaccine. The problem with COVID is there is no evidence that it is a seasonal respiratory infection, in that COVID outbreaks have occurred in every month of the year in every place where they have occurred, which is all over the world, and pandemic. And the duration of protection against simple disease is unknown for the newest preparation and has gotten to be very short for those variants between Omicron and now. So you don't know how long your protection is. Your protection against severe disease and death is probably significantly improved by getting a new vaccine. But if you have a short window of protection, how you time your COVID vaccination is tricky. And again, it's based on personal issues. What's your travel look like? Who will you be exposed to? What part of the world are you traveling to? And what is your underlying status? And remember, although the pandemic may be over, the game of COVID, Thrones, is not over. We are in the process of an endemicization, which is a remarkable thing to be gifted with as a healthcare provider, but it's not exactly clear what that looks like. And I had gone from being very lukewarm about the notion of another vaccine to, I'm going to get one, but I'm going to try and figure out how to optimize the value of the inoculation that I'm going to get. And that's my comments on the community infectious diseases, and open the floor to any further comments, observations, or corrections of what I've had to say.
I want to just note that one more reason for people to not get a flu shot is that this Wednesday, from 9:30 to 1:30 p.m., the county is doing a walk-in free flu shot clinic. That's going to be at the County Wellness Center in Yeadon. I'll put the address in the minutes. It's 125 Chester Ave in Yeadon, PA. So for anyone who hasn't gotten it yet, you can get it for free from the county.
Thank you. You're always on top of these things. That actually reminds me of one other thing. I think there's a lot of confusion among people, because on a public health basis, there's been a lot of people pressing, both at the level of the CDC for getting COVID and flu at the same time, and at the level of some of the pharmacies for even getting all three at the same time. And I think there's some confusion among people. although there is no contraindication to get all three, it is a convenience factor. There's no compulsion to get all three at the same time. And my own practice as a physician would be, I don't really recommend it, to be honest. I don't like to start three medicines at once unless there's an absolute compulsion to start them all at the same time. And in the event that there is an issue, I always think it's nice to be able to sort out what the issue is, which would be impossible to do if you got two or three or even two at the same time. That's not to discourage people who want to get that from doing it, but rather to say there is no pressure to do that. The pressure really is about the low uptake of vaccination this particular season and the notion that making it more convenient for people might improve uptake on vaccination. Okay, anything else there?
I have one other update from the county in terms of infectious diseases. I don't know if we covered this at the last meeting or not. On October 3rd, the county recorded the first case of West Nile virus in Delaware County in 2023. I just wanted to mention it because, well, first of all, they put it on the news section of their website, and second of all, just because I think people think about that as sort of somewhat of a seasonal disease because of the
I missed.
West Nile virus,
Oh, sorry.
because of the mosquito association and the sort of the seasonality of that, and just kind of keeping in mind that as the temperatures stay warmer longer, some of those kinds of things may be an issue more of the year around.
Okay. Thanks, and why don't you keep the microphone, because the next item on the agenda is our food inspection.
Yes, so I am getting caught up on reporting out this month because I hadn't reported over the summer, and then I was traveling, and then we had Samantha, but so I'm going to try and run through these as quick as I can. In June, we had 3 different restaurants that had a perfect inspection. That was 2 stands at the farmer's market and then Rosie's Coffee at the Conestoga Swim Club. There was a follow-up inspection at Starbucks. That was just because there was an issue with their dishwasher, and so they needed to have a reinspection so that they could start using that equipment. We had 8 different establishments that got dinged for lacking a food safety certified person in charge, and my kind of ongoing charge to our business owners to help them do well on their food inspections is to make sure that they have that. And then there were 8 different establishments that also had issues with their sanitizer test kits, so that's just another kind of friendly reminder to our business owners. Make sure that you have your sanitizer test kits near the dishwasher, and also make sure that your staff know how to use them, because that's the other way that you can get dinged on that. July, we had 11 establishments that lacked a food safety certified person in charge. A lot of that was the farmers market, and I know that, and I think I mentioned this when Samantha was here, that they did do a training, so we think that that should be under control now. That was really kind of the main thing for July.
Alex, who does that training?
So there are several different vendors that they can use. The most common one is ServSafe. There are different companies that get certifications to administer the programs, essentially, or get accredited to administer the program, so it's not administered by the state exactly. In terms of having somebody come and do the training there, I think the thought was, since so many of them needed it, they could do a group session there, which there are a lot of different people that get certified to do the training from some of these companies. So, or it might have just been that they all kind of sat there and did it on the computer at the same time.
So the businesses
also
bear the
happen.
expense, the third parties responsible for the certifying, and the state or the county is responsible for administering the
I believe it's
certification?
the state that accredits the programs.
Thank you.
Because there are different certifications in each state.
I interrupted you in July.
That's fine. The good news is it's not that intensive in many cases. One of the other things I've seen is that sometimes if it's a business owner who's been in business a while, their certification might have lapsed and they may not have remembered to update until they get inspected and get dinged for it. But for people who are recertifying, it's not really a big deal. We had, in August, there were 2 establishments that had 0 violations. They were both establishments within Villanova University. We had a trio of complaint-based inspections, and I haven't talked to Samantha about this, but when they say a complaint-based inspection, a better word for that might be incident-based inspection. It doesn't necessarily mean that somebody got sick and complained or saw something in the restaurant and complained. There were 3 complaint-based inspections in Bryn Mawr in August that were in response to a power outage. Basically, it was all 3 were in the same building. It's the building with Insomnia Cookies, Vic Sushi, and Lovebird. So the power went out, and there was an inspection basically to see which food had, gone out of temperature and needed to be thrown out. We also had 1 new restaurant open in Wayne that had an opening inspection. That was the Vanilla Bean. And then there was another complaint-based inspection in August that was in response to a small fire in the pizza prep area at Great American Pub. That area was shut down and then re-inspected and reopened the next day. Then in September, we had 1 complaint-based inspection that did result in a follow-up being scheduled. There was the restaurant At the Table changed locations, and there were no issues observed in the pre-operational inspection for the new location. We also had our first inspection listed at a St. David's mailing address. Minor curiosity. And then we had 1 inspection that recorded 0 violations, which was the Cav Shack at Cabrini University. And then for the most recently concluded calendar month in October, county did a total of 32 inspections. We had 2 establishments that had follow-up inspections this month that will require an additional follow-up next month. That was Spread Baglery and Conestoga Pizza. We had 3 establishments that were cited for issues with hand washing sinks. I wanted to highlight that because we've been on the drumbeat about hand washing this season. In some cases, that can be as simple as everything at the sink is fine, but they don't have the sign up that reminds employees to hand wash. That's a requirement. In other cases, it could be that the paper towel roll has run out and nobody's replaced it. It could be that somebody moved the trash can. They're required to have a trash can with every hand washing sink. It could also be that somebody was using a kitchen sink as a hand washing sink. Hand washing sinks in restaurants have to be dedicated for hand washing specifically. So that's definitely something for all of our business owners to keep in mind as we head into this season. We had 4 establishments that received pest violations, not because of any actual pests that were seen, but because of access point issues. So that means that there's a window that's not fully closed all the way, or a door that doesn't automatically shut, or something like that. But I did want to highlight that because I want people to be aware that you basically get a big red X next to where it says pests and rodents, even if it's just that door being open, not for something actually being seen. So that was just something I wanted to highlight. And then we had actually, for the month of October, we had 6 establishments that recorded not a single violation on their inspections, which is a record for Radnor since the county started doing inspections, so yay for us. That was St. Catherine's Day School, the Grayson School Lunch Program, our own Radnor Elementary School, the break room at the Radnor Corporate Center, Rosie's Coffee in Villanova, and Cheddar Shabbat of Philadelphia, which I think is the cafeteria at JM Barak. So, well done this month.
Excellent, thanks. So there's really no action from the Board of Health's point of view with regard to our obligation towards the Board of Commissioners from that report. But from a broader picture, it seems as though for Radnor, there's been a seamless transition from a township-based to a county Department of Health-based food inspection, A. B, having the Board of Health keep an eye on that just kind of keeps our finger in it, so we don't really have a direct, but I think it's helpful to do these. And C, it seems to me that those couple of townships that decided early on not to play ball with the new Department of Health, that felt very much like that was a cost of services issue rather than anything that we need to be aware of from the point of view of our advise and consent role. Is that accurate? And have any of those resolved their issues with the county, do you know?
I hadn't seen in the news that any municipality had resolved their issues with the county. However, at some point I started hearing that it was 7 instead of 8 that were still fighting it, so I don't know if that means one dropped out, but I did see there was an issue. I forget where it was because I was mostly focused on Radnor. There was one place where an inspector was turned away when they went to do an inspection.
A county inspector was turned away in a township which is not working with the county, is that?
No, maybe I shouldn't even mention
Okay.
that since
Yeah,
I
we
don't know
can-
the
we can
details.
talk about it. Fine.
I just thought of it since you were mentioning that. But no, from my perspective, the county inspections are serving us very well. In particular, Samantha's doing a lot of on-site corrections, which is critical because that gets things fixed right away, so they don't have to wait for the follow-up inspection to get it fixed. So I'm very pleased with what I'm seeing overall.
Excellent. Any other comments, questions? Okay, with that, we'll move to the next agenda item, which is our old business. And you're still on, Alex. The first is a follow-up on the Savage Sisters request for a program related to drug addiction education. And I think you and Kiki had taken
Yeah, I was
on
going
that.
to say I'm going to defer to Kiki.
Alex and I had the opportunity this morning to zoom into the presentation and the training that we're proposing on bringing into the township, and I think we both agree that it was outstanding, and that I'm very excited about bringing that into the township for opportunity for everybody to participate in that. The background was very thorough and very, I think, medically accurate, and so that's important information for everyone to have. We were able to get the approval from the commission, the Board of Commissioners this month. Alex was able to attend that, and that was approved, and we then were able to reserve the presentation date would be this January 16th after this meeting. So that seemed to coordinate well with everyone. And then we would all be here as the captive audience. And so that would be a great way to start that. Did I say the 15th? It's January 16th.
The Tuesday.
That's the Tuesday after, I think it was Martin Luther King Day.
So would that be right after we're at 6:30, or would it be at 7? Or we're not sure yet.
It would be right afterwards. So I want to make sure that although they are occurring on the same date, one right after the other, it is technically 2 separate events. It's the Board of Health meeting and then the special presentation. Of course, we hope that everybody can stay, but part of the reason to separate out the events was just in the event that we don't have a quorum, we can still do the presentation because we're anticipating quite a few community members coming as well.
And I think it's important, the role of the Board of Health was to facilitate a public service meeting, but it is not a Board of Health meeting, it is so a couple things. Are there any expenses incurred other than the facilities expenses of the township? And how do we plan to publicize?
So because of space requirements, we haven't worked out exactly how we're going to publicize yet, only because we're probably going to want to do some kind of registration procedure. The reason for that is that we have a fire code capacity in the building. We, of course, do not want to exceed that. Also, Savage Sisters does some survey data collection at the end of each of their presentations, and just kind of as a courtesy to them, if they already have some format that they're using for registration in order to make the survey more seamless, we want to try to work with them on that if we can. So we haven't totally finalized how we're going to do that yet. We just didn't want to start publicizing before we have a registration link ready to go, other than letting the rest of the board know tonight.
Yeah, that sounds, both of those things sound excellent to get a handle on what the size of the crowd will be, to prevent the size of the crowd from violating our own regulations. And as well, if you do it that way, you'll have a sense, if it's wildly successful and people are excluded, then you'll have a heads up early on knowing that you might want to do more than one. Excellent, thanks guys. Any questions?
Yeah, I just wanted to make one point. If you want, just let me know. I can see if I can get it on the township website as well, once you have your link for registration. I think that would be great. The other thing, and Alex knows this, but I did put it in onto the Board of Commissioners agenda as a lecture series in case you want to do other lectures or do this more than once. So that way you don't have to come back to us every time.
Let me make sure I'm clear. At this point, for this particular lecture, if we wanted to do repeats, we would not have to go back to the township.
That's correct.
But if we wanted other lecture series,
Well, I don't think so, actually. I think that you could, it allows the Board of Health to do what they deem appropriate lectures.
That was my interpretation from the
Yeah,
discussion we
That
had
was
as
mine
well.
as well.
And I think that, the commissioners have voted on our appointment to this board. They've reviewed our qualifications before we joined the board. We were interviewed before we joined the board. I think that they're trusting us to be responsible with anybody that we choose to bring here.
Yeah, don't go wild now.
Right.
so excellent. This program then becomes not only a public service, but a pilot. Excellent, thanks. Okay, with that, next agenda item on old business is Dr. Tessadou, and he's going to update us on the oral health program.
So we've had a successful fall with the Colgate van going through parts of the city of Philadelphia. I was unsuccessful with trying to arrange something with the school district of Radnor. So I came up with a few ideas. David said there is somebody new in the school district that might be able to help us for the spring, but also we might consider, I looked at the website for Radnor and I saw Arbor Day, and it might be interesting to draw a line between deciduous trees and deciduous teeth and have the Colgate van at Arbor Day. And advertise and bring a lot of kids in that way. But we can still, if we have a new contact with the school district, we can try that method as well.
Excellent. Just to review for the minutes, Bob has been working hard on a project that would involve a proprietary organization, Crest, that has a van that is Colgate. Ooh, baby, that is essentially a non-proprietary proprietary program. It is a program about oral hygiene and regular professional care, right? And it was difficult to work through the township school district bureaucracy to get approval for that. So the Arbor Day is a workaround for that. But I had suggested to Bob that PT may have tricks up her sleeve that might allow us to go back to the school district and see if we can't figure out a way to do. Again, that's a little bit like drug addiction education. It's hard to have too much awareness among our youth for oral hygiene and regular professional. That goes back, I think that is a Crest commercial, though. A decay preventive dentifrice proven to be effective in a program of oral hygiene and regular professional care. I think that was the boilerplate language on a 40-year-old commercial. I can remember that, but I can't remember what I had for lunch. Sorry, guys. So thanks, Bob. So we'll put that as an item. PT could not come today. So we'll bring that up when she's back next month and see if we can't work something out there. How's that sound?
I was going to say, if you got the email introducing her, you might also try reaching out to her via email in the meantime.
Sure. And anything else on that? So the next agenda item is student intern program. Lisa, or Julie and Lisa, and maybe the other Lisa, and Chloe.
All right, I'll go first. That my intern wasn't able to come this evening because he is sick. He's been, I don't want to spoil too much so he has more to say next month, but has been in contact about existing information regarding bike racks, et cetera, in the community. And he's also become got a contact through the board for the program in Philadelphia, which is the bike rental, where you can just rent and use the bike and return. So we'll hear more about that next month.
Excellent. Lisa? I'm sorry. Yeah, Lisa.
Yep. I'll speak for myself and Julie, who's in Nevis right now. So Julie, myself, and Chloe met earlier this week, and we did some good work on massaging the topic a little bit. It sounds like, and Chloe, I'll let you say a little bit more about this, but it sounds like in terms of looking at some of the different mental health issues, that sleep is a really important factor that contributes to mental health, particularly with the older high school students. So we talked about creating a survey and capturing some data on how sleep contributes to mental health, and then how to promote, better sleep hygiene. And so, Chloe, if you want to say a little bit more about that, please feel free.
Yeah, so we're planning to, or at least what we talked about at our meeting was forming questions of what to ask on our survey, and we're planning to either gather quantitative or qualitative data, but also specifically like scaling questions to just see how people feel mentally, or the emotions they have, and on the scale of to which degree they feel those emotions based on how much sleep they get a night. Like a specific question that we have is like, do you feel drowsy during the day, which is a big thing that I feel personally with how little sleep I get. And then we'd ask that, like a scale of 1 to 10, and also just any factors that contribute to their lack of sleep as well.
So outside of my field of expertise, but every time I go to a doctor's office, I fill out about 13 questionnaires, and I have to believe that there are already existent and validated questionnaires regarding sleep health.
There definitely could be. I know Julie had mentioned that she had a professor who was like a specialist in the area of sleep medicine. So I know Chloe was going to do a little bit of digging around in that area. I mean, I think that I don't think that we're super, like, I think we're sort of just landing on this topic of sleep because that wasn't in the original proposal, but I do want Chloe to be engaged in a in a project in a way that she feels is meaningful for the high school community as well as herself. So we're just doing a little bit of finessing on the topic. We do want to understand how the effects of little sleep have on things like stress and, what students are facing. We didn't want it to be, so last year the interns did a project on sleep, and we don't want it to be repetitive. It doesn't have anything to do with driving or anything like that, but I guess really the overall effects on how cumulative lack of sleep can affect things like stress and anxiety and depression, and then how to link up with resources once that's identified.
Yeah, my comment really is just questionnaires are tricky things. And they can become, so if you try and start from the ground up and create your own questionnaire, then the project becomes creating a questionnaire and not what you could find out of the questionnaire. And I cannot reiterate enough, there are tons and tons of validated questionnaires, and it should be more of a tool than a goal unto itself. Just a piece of advice, having done a lot of studies and involved a lot of questionnaires.
No, I understand that completely. I just, I wanted to know more about how it's particularly impacting teens, because it is a very prevalent issue with myself and my peers. I see it every day. And then, but also what we talked about at our meeting is what we're also going to do with the data. So, I would have it have a meeting with Dr. Kohler and Bannister to finalize all questions, and then probably send it out before midterms. And then we'd probably get the data collected then, and then we were thinking we could create a brochure on just how to educate our students and parents and probably admin and other people on how it's affecting their students.
Yeah. Pretty aggressive goals, excellent. I would also point out that as Julie pointed out, as Lisa pointed out, last year we did have a program on sleep, and this is our second year where the township completely changed the hours of operation for the school district, because the school district was pretty well aware that timing and sleep are critically important. So you may want to fold that in, and that might be an opportunity. Are there changes that have occurred as a consequence of the change in school timing that might be an opportunity to explore into? Just my own observations. Okay.
It's the only other point I wanted to raise is so I don't know how you're planning on sending out the survey. I did just want to give you a heads up that in prior years we have run into roadblocks with sending out an entire school-wide survey. I'm not exactly sure what all the roadblocks have been, but there are some privacy things that go on, and then just also, as you may have started to see, there are just layers of approval that have to happen anytime you do anything with the school, and I think sometimes in the past we've finally gotten approval and it's been too late. So you may want to take a look, if you're committed to doing a survey as your kind of module of the project, at something like more of a focus group, or figuring out how you're going to get some sort of statistically significant sample of students. If you, I wouldn't count on being able to send one email out to the entire school, unless you happen to have the email address for every student already in your Outlook or something like that. But that was the only other point I wanted to raise.
I know, that makes a lot of sense. But usually surveys are sent out on our school platform called Schoology. So that's an easy way for most students to access it. Is we could have Dr. Mack, our principal, send it out. But I can always check with Dr. Mack about how to get a survey approved.
Yeah, I would definitely do that sooner rather than later, because we've run into trouble. I mean, administration's a little different now too. So, you may be able to make it work, but just to make sure that, before you figure out what survey you're going to administer and et cetera. Figure out, are you allowed to do this? What kind of approval? Is the principal's approval enough? Do they have to talk to the school board? You know, what is necessary?
I just want to make a comment. So I've done a lot of research in sleep medicine. So there is a survey that's called the Epworth Sleep Study, and it's a very quick, easy sleepiness scale, and it measures how sleepy you are, basically. And there's only 15 questions, and I think it would be nice if you might want to incorporate that into your questionnaire. It's the ESS, the Epworth Sleep Study. Yeah.
Well, excellent. You've got a resource here. I'm volunteering Bob to be your sleep resource.
Thank you.
Any other comments there? Okay. Well, with that, I think we can move on to new business. And Maggie, the floor is yours.
Oh, thank you very much. Well, not a whole lot happening on the public health portion of the Board of Commissioners, but we are in the thick of budget season, which is, you know, hazardous for my private health. And I want to put a little pitch out for the township is undergoing a comprehensive plan. And redoing it hasn't been done in, I don't know now, 20 years or something. So you'll find a poster out in the lobby. There are bookmarks and flyers. There's a survey going on. If you have, it's quite open-ended. If you have any comments or things you have a vision for the comprehensive plan for the township. So just wanted to put a little plug there for that. And they're right, the flyers and bookmarks are right at the desk. Public health-wise, we have some sort of peripheral things that are going on that are all very exciting, mostly environmental things that we do have 2 electric vehicles that are being purchased by the police force, which would be our first 2. And there will be chargers set up here at the township building for those, and eventually some public chargers as well. So I think that's a good step in the right direction. At the last Board of Commissioners meeting, we approved changing all of the street lights in Radnor to LED from the current. There are already quite a few individual ones had been changed over, but we're putting now the sort of newest, best technology in on that. So that should be good, energy saving. As Sarah and I were talking about before this, the Shade Tree Committee and company, shall we say, Public Works and volunteers planted over 150 trees this past weekend and have been over the last couple of weeks, scattered throughout the township. There was a major planning issue, I think it was at Philippone Park this weekend, but they're up and down King of Prussia Road. You'll see them scattered about, which is always good for us and for the environment. And then another sort of personal health issue is we have gotten a grant for and are putting up a bridge height warning system at the King of Prussia SEPTA overpass. As that is an overpass that gets hit about on average once a month. And is really frustrating for those of us that live on King of Prussia Road, and detrimental to many trucks, shall we say. So it's going to be one of those things that dangles down and would hit you preemptively if you're driving from either side, rather than the flashing light ones, which actually have been shown not to work. There are, I counted them, at least 10 signs that say the overpass is 10 feet 10. There's one that says coming up in a mile. There are 3 right in front of it on either side, which do nothing. So hopefully this will be effective. That's the end of my report.
Thank you, Maggie. Thanks for keeping us updated, and thanks for your efforts. So the next, any other comments? Questions? Please.
I was just going to ask any updates on the rewrites for the animal ordinance.
They're going along. There's a big, so Parks and Recreation, it's in their ballpark right now as they're talking about off-leash dogs in Skunk Hollow. And they were to have made specific recommendations to the Board of Commissioners, who was going to address this, and we were going to rubber stamp it. I'm all ready, pretty much. It's controversial at best. So no new updates. How about that? The recommendations that came to the Board of Commissioners were not specific at all. They were sort of every idea, sort of the interesting ideas like limiting by day or hour. You know, all these ideas were thrown out, but there were no recommendations made to the Board of Commissioners. So it's now back at Parks and Rec.
I actually have info in that regard, because the Parks and Rec, the woman who's the head of the Parks and Rec,
Tammy Cohen.
Tammy, had gotten in touch with me because she thought that our new ordinances might have contradictions or conflicts, but I couldn't figure out what she thought those were, except for the fact that when I pointed out to her that we didn't see any problem at all with having a different set of considerations for what you might require for the management of your pets on the streets of downtown Wayne versus in a dog park versus in a multi-use trail. I think that cleared that up for her, but it doesn't sound like they've focused yet on exactly how we want to qualify those various different things.
That's exactly right. It's the where and the when that are a problem.
And in this township, I think it's trail by trail and park by park, the amount of shall we say, emotional angst that has gone on over this, and people love their dogs, so thank you.
I was also going to ask if there was an update on the police mental health, just how that's
So we
progressing
have,
along.
as I think I told you last time, we have hired a social worker. She's wonderful and is out there working. Her dedicated team is awaiting these new trainees to finish their orientation, and then some of the senior folks can step and be dedicated to the team as well. So really nothing's changed in the last month. We're just sort of waiting for the training to be complete.
All right, with that, the second new business item on the agenda was an update from PT, who was compelled to travel, but she did send me an update that I'll review quickly for you. Wanted to report that the school district had flu clinics on October 13th, 17th, and 19th with high turnout, and she recommends continuing this service for our community in the future. She provides a health date, and bottom line, there's a little bit of everything everywhere, but there's not a lot of anything anywhere. And that includes upper respiratories and GIs, but no outbreaks to report. The Pennsylvania Youth Survey was submitted to the 6th, 8th, 10th, and 12th graders in the township on November 13th. Results pending. There was a ribbon cutting for the Accessibility and Wellness Project, which I don't know if that relates in any way to the student intern project that we had coming out of the Board of Health 4 years ago now, I think, but that was...
I don't think so. That was in process for quite some time.
That was in process. Okay,
Yeah.
good. Excellent. But it includes an accessibility and wellness infrastructure project, and there was a ribbon cutting for new facilities, which will be staffed in the afternoon after school by the head football coach. And then...
I actually went to the ribbon cutting, and it was wonderful. They had self-guided tours by students through the new accessibility area, the accessible bleachers, that whole middle section where you can get a good view over both ball fields on both sides. They took us into the swimming pool, which has been redone. I didn't bother to go into the locker rooms, just didn't really want to reminisce about high school locker rooms that much. But they also have a wonderful picture board. Part of it is on Emlyn Tennell, other stars of Radnor High School sports. So it was really.
Excellent, thanks, Maggie. So this is an upgrade for the entire community at the high school athletic facilities. Wonderful. And then the last item on PT's update was the Ithan Elementary's community outreach, which collected monetary donations for ElderNet throughout October to continue the Ithan tradition of helping to provide Thanksgiving meals to elderly and disabled adults in our community who are homebound and food insecure. To quote PT, "We are proud of our elementary students, teachers, and administration for working towards such a worthwhile cause." And that's what I have on the update from our school board. Any questions, comments, concerns? No. Anybody have any other new business to bring up for the board at this point? Anybody from the board? Maggie? No? And then that brings us to public participation. And we do have a member of our public in the audience. Sarah?
Sarah Pilling, 29 Garrett Avenue, a 41-year resident in Radnor Township. I wanted to thank Alex and David, who, without being reminded, brought up the subject of heat at your last meeting. It's nice to keep it forward. In the last 3 or 4 days, both Lancet and the COP28, which is going to be in Dubai, have both said that despite the fact that this summer here it wasn't as bad as last summer, this is going to be the hottest hottest year on record worldwide. So it's something we cannot forget, particularly little children and seniors. So I ask you to keep it in mind. I hear via the Vine that Public Works, there were a couple of days this summer when they were very cognizant of the heat and people did not work. But I worry about the day camp and I worry about Public Works working. Although the heat was not as long, we certainly didn't have 21 days of over 90 degrees like last summer, where the nighttime temperature rarely got below 85, which is where we're really in trouble. But I wonder if the Board of Health doesn't want to hook up with Parks and Rec for the day camp, and also with Public Works, so that they begin to be educated to keep their employees cool in the hours. I know that in other cities, particularly in the Southwest, which you can understand, staff's now starting at 3 o'clock in the morning, so they're done by 11. So they're out of the heat of the day. So the other thing I wanted to bring up is a by the way. As a senior who doesn't have Medicare Part D, which is prescription, because I only take one prescription, and who has COPD, I'm sorry to say. I used to call it chronic bronchitis, but they've changed it. For me to get a shot this year is $564. Guess what? On Social Security, I'm just going to be wearing a mask. So it is a problem for seniors who are living on limited income, and the fact that age-wise and health-wise, we should get it, but we can't if you don't have prescription Plan D. Now, I've been 65 for a long time, so I would have to pay a penalty of $2 a month for every month that I didn't have prescription Plan D to start again. So at this point, guess what, guys? I'm never going to have prescription Plan D. It's a choice I made when I was 65 or when D came in, but you're caught after a while. And as I was telling David, to make it even worse, Social Security tried to cancel my Social Security this summer. There are 608,000 Americans who, in this year alone, as of the first week in October, where Social Security has tried to cancel our Social Security. And if you watched the program that was on 60 Minutes last week and the week before, and it's now streaming on CBS, Medicare and Social Security are assuming that we, the recipient, can identify the problem if there is a problem and pay the penalty. The good news is, and this is what I did, I got Mary Gay Scanlon involved, and they reviewed it for 10 years, and I'm now getting $1 a month more, but I don't trust it. So every month I wait to see if my Social Security comes in. What the mistake was, I had my own earnings, and then I had a widow's pension. So they said, oh, well, you can't have two pensions. And eventually, through Mary Gay, it was straightened out. But this is a real problem, folks, for seniors and for people on SSI. On the 60 Minute thing, there was a guy who was born with cerebral palsy, so he's been on SSI. He's now in his late 30s, I'm guessing. When he was 11, his mother got an extra payment. When he was 11, now they're coming after him. With interest over all the years, probably 20-some years. So just be aware of it. It's not your problem, but it's a real problem for seniors. They're going after older, lower-income people. And it's hard to figure it out. So let's just keep our eye on the weather.
Thank you, Sarah.
Thank you.
Alex, the program at Yaden for flu inoculations.
I was just going to mention that for anybody for whom cost is a concern, this is specifically for flu, but for anybody for whom cost is a concern, this Wednesday there is going to be a free flu clinic from the county at the Wellness Center at Eden.
Okay, thank you, Alex. Thank you, Sarah. So with that, we're through our agenda, and it just happens to be 6:30. Do I have a motion to adjourn?
Motion to adjourn?
A second?
Second.
Meeting is adjourned. That's a grand idea. Right.